Ladies and gentlemen, this is a story that came out in HuffPost. Most Americans who can't get pregnant have no way to access treatment because the treatment is so much money that most people just give up and they don't have any treatment and just go without having children. And when you look at the price of in vitro fertilization, it's ridiculous. So we go down here. It talks about a woman that had miscarriage, and they're saying if you go to get treatment, it's $2,100 for the embryologist fee, $39.50 for the chromosomally screen the embryos, 2 in vitro cycles, 1 frozen embryo transfer, countless injections, $55,000. See, most people cannot afford that. That is so much money. Most people cannot afford to even get the treatment. But this person did end up having a daughter, but had to go to countless treatments to even have one child. Now, the infertility story is very common. Most childless people in America who can't conceive a baby or carry a pregnancy to term have not seen a doctor about it. And I believe that. And even if they have, they probably can't afford the infertility treatments, rarely covered by even the best health insurance that might ultimately solve their medical issue. In this country, we think of infertility as a private tragedy to overcome with individual grit and a personal credit line. If you don't have either of those things, you're pretty much screwed. Okay, so I'm just going to go down a bit more. In all, an estimated 12% of US women, or 7.3 million people, have problems getting pregnant or carrying a pregnancy to full term. And access to infertility treatment is declining, while the rate of people who need these services is rising. From 2006 to 2010, the last time the federal government published this data, only 38% of childless women of reproductive age who had fertility issues had ever used any kind of infertility services, down from 56% in 1982. While fertility issues strike people of all races, economic brackets, and educational levels, the research showed that women who have less access to healthcare and insurance are not even most at risk for both infertility and the consequences of a lack of access to care. For example, researchers estimate that compared to white women, Black women have 43% higher adjusted odds of infertility. I'm just going down there. Latino women, 28% higher adjusted odds. The reason for this disparity are complex, include biological reasons, as well as social and cultural barriers. But we can't even begin to address these barriers to infertility treatment without seriously grappling with the most obvious one, the cost. Okay. No, the white women can get it because they have the money, where the Black and Latino women just simply don't have that kind of money to put into infertility. And to be honest with you, I think y'all full of crap, because let me tell you something. Every Black person I know got kids. Damn near all of them do. Um, an initial consultation at a fertility clinic can cost hundreds of dollars, and the average patient going through IVF treatment will spend $24,373 in an 18-month period. Damn. Oh my God, that's a lot of money. Neither are likely to be covered by health insurance. The high cost of treatment and the fact that most insurance plans don't cover the most effective procedures ensures that it's mostly white, highly educated, and rich people who can have access to infertility services. And I believe that. With those prices, yes, I believe that. But even among the women privileged enough to get some kind of care, only 3.1% had ever used assisted reproductive technology like IVF. During the most recent studied period, about 56% of women who sought medical advice stopped after the consultation phase or just got some basic testing done. We can't know why most couples stop at basic testing or consultation, but one guess is that it's all they can afford. Well, I would say that's the right guess. Although IVF is a 40-year-old technology and more than 8 million children have been born using these technology, private insurers are loath to add IVF or any other new service to their standard coverage plan unless legislators force them to. Well, in 40 years, if they haven't forced them to do it, they're not going to do it. 40 years? That's starting to happen. 15 states have laws that mandate insurance carriers cover fertility treatments in some way. Okay, so what does in some way mean? Just a few tests? That don't sound like the whole procedure, or at least offer coverage. But only 6 of those states offer meaningful access to treatment like IVF. And only those who fit the current medical definition of infertility, straight couples who have had sex for 12 months without conceiving, even qualify for the few health insurance policies that do cover these treatments. That means LGBT couples, single people, and those who have medical issues that will cause future infertility are locked out of life affirming treatments like IVF. That means the US infertility treatment policy serves as a de facto referendum on who is in the country gets to pass on their genes, give birth, or be a biological parent. Wow. Intentional or not, this status quo says that only certain kinds of people are worthy of making families, and only certain kinds of families deserve our support and resources. One of the most common arguments that infertility advocates face about taxpayer funding for infertility treatment is the notion that poor people shouldn't be offered extra help to have their children because then they would need extra help raising them. Or, as a healthcare policy analysis once put it to me, nobody wants to help poor people have more kids. No, you because those are the ones that can have kids. That's why. Okay. I think that's outrageous what they charge. That is ridiculous. The birth rate in the US has hit a 30-year low, and indeed has been below the rate needed to replace the population since 1971. For a country with political leadership that is simultaneously trying to limit legal migration while also freaking out about our record low birth rates, we're taking a really long time to come to the realization that if we want to bring our fertility rate back to population replacement levels, we're going to have to take a long, hard look at all the ways we can make this country a hostile place to raise a family, whether it be a lack of affordable childcare or a lack of access to infertility treatment. Well, I don't know. Mm-mm-mm. But they're talking about Denmark that has free public health care and they still have a low uh, birth rate. That's because it's genetic. It doesn't matter what insurance you have, free or you're paying for it. If your genetics aren't right, then you're not going to have babies. Meanwhile, in the US, only 1.7% of babies born every year are conceived through assisted reproductive treatments. Okay. So they are saying they're currently treating about 40% of their patients who might actually benefit from IVF. If it were covered, the number of treatment cycles would increase 2.5 fold. America's reluctance to help fund or at least mandate health insurance coverage of infertility service makes sense in the broader context of the country's debate over whether health care is a basic human right or a privilege you have earned. 16 states still haven't chosen to expand Medicaid. So the notion that we should help pay for treatments of a non fatal medical condition like infertility seems like a long shot at best. Hmm. Well, to be perfectly honest with you, I'm surprised they haven't, being that most of the women accessing it are white women. Like I said, at those prices, I know a lot of people cannot afford that. It's just not affordable. Now, one third of adults in the US say that they've either used fertility treatments or know someone who has. More than half of Americans, 55%, think that insurance should cover infertility treatment, including IVF, and two-thirds say the doctor should provide those treatments without regard to a patient's income level. With this cultural change comes political change. Several states are now passing new laws that both widen access to infertility service and simultaneously expand the definition of who might need these medical treatments beyond those deemed infertile. Wow. So please tell me what you think. The way I see it, let me go back up to those prices. That is ridiculous. Let's see. Yeah, like this person, she had two in vitro cycles, had a frozen embryo and a bunch of injections. In an 18-month period, she spent $55,000. A lot of people do not have that kind of money to spend in an 18, it's just too unaffordable. So I don't know. You know, I don't know anything about this mess. I had my son the natural way. But please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I will see you on the next video. Peace, family.